are so many questions out there about the COVID-19 vaccine, especially as we're seeing COVID cases rise and the Delta variant continuing to spread.
And there are a lot of misconceptions, which is why we like to talk to the experts to stand for truth, as we always try to say on King 5. So we're joined now by Dr. Larry Corey, the world-renowned expert in virology and immunology, based here in Seattle at Fred Hutch, and Dr. Corey, coordinating the vaccine development across our country. A lot of people are hesitant about getting the vaccine, Doc.
Yeah, and we spoke with one woman, Dr. Corey, yesterday. She is choosing not to vaccinate herself or her son. Listen to what she had to say.
They call it a clinical study because in a sense that's what it is right now. I mean, they are just kind of receiving data on those that are vaccinated, any possible side effects, and it's so new.
So that parent, Dr. Corey, is, hesitant about the vaccine. Some people say they want to wait for the FDA to fully approve the vaccines before getting the shot. What's your response?
Well, we're way past any clinical study. We're at 400 million people. We've had the studies all over the world show the vaccines are highly effective, including against the Delta variant. We are in the midst of an epidemic in which the fuel of this epidemic is unvaccinated people. And the responsibility here is that you as an unvaccinated person can unwittingly take this agent, which is actually a variant that is more infectious, and infect other people. I think there's a societal responsibility. It's not just individual choice anymore.
Dr. Corey, what is your biggest concern about COVID right now?
My biggest concern is that we have an enormous epidemic going on, including our own state, our own region. Children's Hospital is seeing more and more cases. University and all our hospitals are seeing more and more cases. We see what's happening in Florida and Arizona. And it is an epidemic of the unvaccinated. That's who has ended up being the fuel and has ended up being in the hospital. The vaccines are 98% protective against hospitalization and serious ICU, serious disease, and even sort of higher almost for death. So really, we have a tool. We know the vaccine actually works against Delta. Yes, you can occasionally break through if you get vaccine, but you will have very mild disease, and that's occurred, documented again many, many times.
What do we know about people who are vaccinated, Dr. Corey, and their level of virus shedding? What do we know now that we didn't know before about that?
Well, Delta it's a tougher variant than the original variant. So yes, you can shed virus. If you get vaccinated, you will have asymptomatic disease and you will, quote, shed virus for a couple days. Equally, almost, it looks like, as if you were not vaccinated. But from day 3 on, it's a precipitous fall with the vaccine, and you continue to shed it and spread it otherwise. So that's why you're sort of seeing that it's like, okay, you can have a little bit of an ember, but you will not have a fire.
So many parents want to know, when will younger children become eligible for the vaccine?
I can't answer that. I do know that one of the companies, Pfizer, has completed its trials between 5 and 12. They are submitting it to the regulatory agencies. There are some discussions, there's some rules associated with that. I certainly am an advocate for elementary school kids to have approval and get vaccination. Risk-benefit ratio will be very high for them. Having said that, we can have safe schools with vaccinating adults, wearing masks, and having access to testing.
And do you advocate for the state mandating teachers, staff at schools be vaccinated before the school year starts or at the beginning of the school year?
Yes.
Okay.
Dr.
Simple
Corey,
answer.
as always, the experts know what they're talking about. Thank you so much for joining us on King 5. I know we'll be talking to you again throughout the coming months. Thank you, Doc.
Pleasure.